March is Child Life Month, and joining us with more is Child Life Manager at Sanford Children's, Carrie Knott, and Lead Development Officer at the Sanford Foundation, Bethany Olson. Thanks for being here.
Thanks for having us.
Yeah, so tell us kind of a little bit about this month and why it's important.
Yeah, we're celebrating Child Life Month here at Sanford Children's Hospital, so really we're just lifting the work that our child life specialists and child life assistants do at Sanford Children's, and just really want to appreciate them and thank them for everything that they do, but then really raise awareness about the value that they bring to our patients and families at the hospital.
Yeah, talk a little bit about that value and what they do day to day for these children.
So essentially our jobs are to really just help kids have a positive coping experience when they're in the hospital. So you think about it, adults are intimidated when they're in the hospital or have to go to the doctor, so it's extra hard for kiddos. Our job is just to help them have that positive coping experience. So we're specially trained in child development and family systems theories, but really taking it a step further with how does that development impact kids' perceptions of the medical environment. And so it's our job to just break down that language for them in that fast-paced medical world and really help them understand and navigate the medical setting.
Yeah. What are some examples of the impact this has had in children's lives?
Absolutely. So we utilize several different kinds of modalities and interventions as child life specialists. So doing medical play with kids, what do kids do every day? They play, so it's important to incorporate that into their stay. We prepare kids for procedures. That psychological preparation is so very important for kids to know what's going on so we can empower them with the tools to cope with what's going to be happening. We do therapeutic interventions with them to help them express and understand their diagnosis, as well as grief and bereavement support, but then just normalizing kinds of events too that are really fun for kids in the hospital too, because we want kids to be kids while they're there as well.
Yeah. How has support maybe changed or evolved over the years that you guys have done this?
So we at the Sanford Health Foundation are able to support Sanford Children's and the Child Life team. That program is entirely funded through philanthropy, so it's individuals and organizations in the community who step up to say, yes, we want to make sure that we have child life specialists at Sanford Children's, giving back, whether it's $1 at a time when you go visit a Walmart or a Costco, or it's a major gift of $10,000 or more. Those donations make an impact. In this past year, we saw a record year in giving, and that doesn't mean that this year there's not a need. The need is even greater because we want to continue to support this great program and continue to have it available for patients, and the families never see a bill for that service.
Yeah. And what are some other ways people can maybe get involved and help support this?
So coming up in April, we will have several ACE hardware locations doing roundup campaigns to support Children's Miracle Network. So that's one way that you can just donate pennies and those will add up. But you can also connect with any of us at the Sanford Health Foundation and we can talk about other gifts as well.
Yeah, and just understanding the impact this can have is just also just so important too.
It is. I mean, when you're working in pediatrics, in our role as child life, the patient's not just the patient, the family is the patient essentially. So just taking the time to slow down and address those psychosocial and emotional needs of kids and families in the hospital is really, really raising the bar for the care we provide at Sanford Children's. We're really proud of that.
For sure. Thanks so much for being here.
Thank you.
Thanks for joining us.
Yeah, stick around, we do have more after the break.